Good afternoon. This year marks an important turning point for Bermuda's health system. The 2026-27 budget represents one of the most significant investments in health in our country's recent history. More importantly, it marks the moment where health reform moves from planning to implementation, a year focused on alignments, accountability, and measurable progress across the health system. For too long, discussions about reform have centered on what should happen next. This year is about ensuring that the structures, investments, and partnerships across our health system are working together to deliver real results for the people of Bermuda. The Ministry of Health, including headquarters, the Department of Health, the Health Insurance Department, the Bermuda Hospitals Board, and the Bermuda Health Council, remain guided by the clear vision, healthy people in healthy communities. For the 2026-27 fiscal year, the Ministry of Health has been allocated the sum of $302,478,000, which represents an increase of $57 million over last year's budget. This represents one of the largest health investments Bermuda has ever made. But this investment is not simply about sustaining services. It is about strengthening inclusion, improving affordability, ensuring accountability, and modernizing our health system for the future. One of the most important priorities in this year's budget is ensuring that residents who are currently outside of the healthcare system have a pathway into care. Through the new Health Inclusion Initiative, we are creating an entry point into healthcare for uninsured individuals by providing access to a defined set of essential services. On an island as connected as Bermuda, leaving people outside the healthcare system ultimately harms everyone. Untreated chronic conditions become emergencies. Preventable illnesses become costly hospital stays. The Health Inclusion Initiative allows individuals to stabilize chronic conditions, access treatment, and begin engaging with the health system in a structured way. As the broader core benefits framework under universal health coverage is implemented, individuals entering through this initiative will transition into a unified coverage model designed to work more efficiently and sustainable for all residents, investing in prevention and early detection. This budget also strengthens our focus on prevention. We know that Bermuda faces a growing burden of chronic diseases, including diabetes, hypertension, and cancer. Treating these conditions only after complications develop is costly to our health system, and it's, of course, devastating for the patient and their families. This is why this year we will move forward with a national screening program designed to detect chronic conditions earlier. Earlier detection saves lives and reduces long-term health care costs. And to support this work, the ministry is strengthening claims analytics, real-time health data systems, and population health dashboards, allowing us to identify risk earlier and intervene sooner. Our goal is to shift Bermuda's health system away from crisis-driven spending and towards prevention-driven sustainability. And this budget also makes a direct investment into the next phase of universal health coverage. A total of $3 million has been allocated to advance UHC implementation and strengthen the digital infrastructure required to support it. This funding will allow the ministry to modernize the legislative and regulatory framework, complete actuarial and financing modeling, design provider payment schemes and structures, strengthen digital health systems, and expand claim analytics and population health dashboards. Universal health coverage is not simply a policy goal, it is a commitment of fairness. It ensures that every resident has access to essential health care benefits and services without facing financial hardship, while also providing the system with the stability and predictability required to plan for the future. Another major priority in this budget is strengthening long-term care and community services. Hospital beds are increasingly occupied by patients who are medically fit for discharge but cannot safely transition back into the community due to limited care options. To address this challenge, we will establish a 30-bed transitional care unit designed to relieve the pressures on the acute hospital services and improve patient flow. We will also advance the rebuild of Leafroy House and continue progress on the expansion of the Sylvia Richardson Care Facility, increasing long-term care capacity in our community and ensuring that seniors receive care in the most appropriate setting. Complementary to these investments, a home-first strategy, which will be supported by remote monitoring technology and coordinated community care, will help seniors remain safe and independent in their homes whenever possible. Primary care infrastructure will also be modernized, and this includes refurbishment of the public clinics in Hamilton, St. George's, and Somerset, ensuring that residents have access to modern community-based care. The ministry will also advance the following: interoperable electronic medical records, expanded e-prescribing, and digital navigation tools that will make it easier for residents to understand their benefits and access care. These improvements will make the system easier to navigate and strengthen coordination across providers. And a major component of this budget is the $55 million in operational support for the Bermuda Hospitals Board. This is the single largest health investment in the 2026-2027 budget. And this funding will do the following: meet BHB's statutory and contractual obligations, address near-term cash flow pressures, stabilize hospital operations during system reform, protect continuity of care at King Edward Memorial Hospital as well as MWI, support safe staffing and essential clinical services as well. And in addition, the budget allocates $10 million in capital funding for KEMH and $2 million in infrastructure upgrades at the Mid-Atlantic Wellness Institute to help to modernize equipment and strengthen clinical environments. For the public, these investments mean shorter wait times, smoother admissions, improved patient flow, and more reliable access to emergency, acute, and mental health care services. However, stabilizing the hospital is only one part of the solution. Stability cannot come at the expense of innovation or reform. Our responsibility is to ensure that the entire health system works better, from prevention and primary care to long-term care and digital coordination. This budget ensures that while the hospital remains stable, the broader system continues to evolve and improve. This budget also strengthens supports for seniors and working families. A total of $14 million has been allocated to expand the benefits under HIP and Future Care, including the free annual health examinations, the expanded prescription drug coverage, and a predictable $25 copay for primary care visits. These improvements reduce financial barriers to routine care and help residents manage chronic conditions earlier. And in addition, $15 million has been allocated to subsidize future care premiums for approximately 2,200 low-income seniors, ensuring that they have continued access to essential healthcare services. Healthcare reform cannot succeed without the people who deliver care every day. And this budget includes additional investment for nursing scholarships, workforce training, and professional development, ensuring that Bermuda continues to build and retain a strong healthcare workforce. When we invest in our healthcare professionals, we strengthen the entire system. And this year, we will also focus on accountability and measurable progress. Every investment made in this budget must translate into improved services, stronger system performance, and better health outcomes. Our responsibility as a government is not only to fund health care, but to ensure that the system delivers value and fairness to the people of Bermuda. And before I conclude, I want to thank the healthcare professionals who serve our community every day with dedication and compassion. Their work is the foundation of our health system. This budget represents more than increased spending. It represents a shift towards prevention over crisis care, inclusion over exclusion, affordability with accountability, and a health system designed to serve every resident of Bermuda. The year ahead will focus on alignment, accountability, and progress. Together, we will continue building a stronger, fairer, and more resilient health system for Bermuda. Thank you.
Thank you, Minister Wilson. We will now take questions from the press. We will start with Jasmine Patterson from the BBC.
afternoon, Minister.
afternoon, Jasmine.
Thanks for your remarks today. $302 million, that's quite a high bill for your ministry. Do you believe this is attributed to one-off costs, such as loan repayments, things like that, or do you expect this to be a sustained budget financing block for you?
Yes, these investments that you've seen within our ministry will help to reduce some of the long-term costs that we see with respect to the absence of long-term care within the community, the challenges that we see at BHB with respect to the bed blocking in the emergency department, and patients are unable to go to the acute care where they should be serviced because of the blockage of beds. So part of this budget, which is critically important, will help us to address that issue as it relates to long-term care and also providing services in the community so seniors can age at place. So we're going to utilize technology so that persons can be monitored at home as opposed to in the hospital or in other different care settings.
When do you expect this additional 30 beds to be constructed? Do you already have the space? Can you give us some details on that?
We are looking for these 30 beds to be, the beginning of that process will be this year, because we do recognize that there's certain aspects of planning and the like that have to be facilitated. But we will start, now that we know we have the money, we will start very, very quickly, because we recognize this is critically important. So these individuals will be transferred from the long-term care part of the hospital, the old hospital, into these facilities, and they will be at MWI.
Okay.
There are 2 floors that are currently vacated at MWI, and those will be the ones that will service these 30 beds, and they'll be renovated, and we'll move individuals from the old part of the hospital to MWI, and then persons on the acute care. So we'll be able to free up beds in the acute care center so that the hospital can run as an acute care facility, which is their mandate legislatively.
Will this be prioritized, perhaps planning permission, obviously within the law, but, pushed along? I mean, you say the plan's starting this year, but when do you see this being active?
Well, when the money passes to our hands on April 1st, we will go ahead and start the actions. I mean, obviously, there are certain legislative matters that have to take place with respect to the requirements under planning and the like, but we recognize the urgency of this, so we will be moving expeditiously so that we can facilitate these long-term care facility extension at the MWI.
Sure. When it comes to expanding healthcare benefits to unemployed or uninsured, around how many people will benefit from that, and what are some of the services on offer?
As I always say, the devil's in the detail. We anticipate right now, we know that there are approximately 12% of the population that are uninsured, but we obviously have to create a system where it is not abused. So we need to look at ensuring that we know exactly what people fit into that pocket. So then once that exercise is done, at the same time, we'll be looking at the type of benefits that will be offered to them. We certainly know that prevention will be one of them, so we will ensure that they have access to a prevention physician's appointment. We also recognize that many of those individuals have existing chronic conditions, and it's far more costly for them to be treated in the hospital as opposed to be treated within the general population of physicians. So therefore, we will be ensuring that not only are we able to identify those individuals, but also provide them with the services that they require so that they can be treated within the community. Because we can't live in a society like Bermuda where we have persons that are uninsured. The other part of that is that once we introduce the rollout of the UHC, they'll transition to UHC.
So would this plan include dental, eye care? What kind of coverage?
It is unlikely. It will be the essential services that are required insofar as keeping persons healthy. At this point, it's too early to say what those services will include. But more details will be revealed in the public once we finalize the operation of this matter.
Sure. I believe BHB took out a loan November 2025, or the government did on their behalf. Is there anything that rings a bell on that, or have I got that incorrect?
I think you may be referring to an overdraft. The BHB was operating on an overdraft. However, part of the monies that will be allocated to the BHB will help them to be sustainable. It'll help them to discharge some of the statutory obligations that they have. It will help them to ensure that they pay the staff, because you'll recall that there was an agreement between the BHB and the BPSU with respect to back pay as well as COLA moving forward. So the monies that will be provided to the BHB will help to ensure stability. However, at the same time, we also will continue to monitor, because there is an expectation that the money will be spent and put to a useful purpose.
Certainly. And just lastly, on UHC, it's a major overhaul undertaking. I wondered whether consultation, communication with the island's insurance companies, if that dialogue has changed at all now that we're nearing closer. Do you expect people to perhaps, want to take part in the UHC versus, personal
When we
health
introduced UHC, this has been a marathon, not a sprint. Most countries that introduce universal health coverage, it takes them decades. We commenced this exercise following the conclusion of our health system financing reform, which concluded in 2018-19. The next step, obviously, was to continue with the UHC transferring to the UHC. Everybody knows what happened in 2020. So regrettably, we did have a pause for 3 years because of COVID. We've picked it up. We have the steering committee, the project management team that's helping largely to drive UHC. We have the clinical senate. We have there's a number of subcommittees that I've spoken about previously that are part of that. And as it relates to UHC, you'll recall that in January of last year, we introduced the first phase of UHC for HIP and future care patients, where we increased the drug benefits for HIP patients from $1,000 per annum to $3,000, and for future care patients from $3,000 to $5,000. We offered a preventative screening, a doctor's visit with a set $25 copay, and then moving forward, we are anticipating still rolling out UHC by Q3 of this year. We continue our negotiations and our discussions and our stakeholder engagement with all of our stakeholders, including the including the insurance companies and the medical professions as well. We are on target. I don't anticipate that there'll be any further challenges per se, because we've kept stakeholders informed since we started this right after health financing reform in 2019.
Just lastly,
Sure.
sugar tax, is that here to stay? We didn't hear too much. We haven't heard much about it in the last couple of years.
The government did commit to sugar tax. We rolled it out in 2018, and then 2019 was the second iteration of it. The omnibus surveys that have been produced since then have indicated that there has been a reduction in the consumption of sugary drinks for adults. So we're seeing the progress.
By how much?
You'll have to look at the omnibus surveys, as that's a matter of public record, but there has been a reduction in the consumption by adults of sugary soft drinks. The sugar tax, again, that was a commitment, that was a throne speech commitment, a platform pledge actually by the government previously. It is here insofar as there have not been any discussions heretofore insofar as it being removed. Many jurisdictions, in fact, Bermuda did receive accolades from the Caribbean, because many jurisdictions that implement programs such as a sugar tax, where there is a financial detriment to discourage the participation or the consumption of a particular product, don't see massive dividends from the health population until a generation. So it has been only a couple of years, but again, the omnibus surveys will confirm that there have been a reduction in the consumption of sugary drinks by the adult population.
Okay, thank you.
Yep.
Thank you, Jasmine. We'll now have Alva from the Royal Gazette.
Good afternoon, Minister.
Good
Just
afternoon,
have two
Alva.
questions. On universal health care, you mentioned that plans are in place for full rollout in Q3, I think you said.
That's correct.
Could you say, yesterday in Parliament, you said that the government is going to advance the aspects of legislation that's going to be worked on in the lead up to that.
Thank you. So you were listening. I didn't think anybody was listening to the budget yesterday. I will be presenting to Cabinet in the coming weeks what the core benefits package will look like. And then in addition to that, there will be a requirement with respect to how the single payer system will be operationalized. Again, when we did health financing reform financing in 2017 and 18, the government committed to a single payer system. That will require legislation. So we'll be advancing that in the next couple of months as well.
And another question on yesterday as well. You spoke about the central lab having some issues, I think, with the equipment, with testing of narcotics, I think you said. I think you said that there's also like a shortage of staff there. Can you say how the government plans to address these issues?
Yes, thank you. With respect to the central lab, there is, we are desperately trying to recruit staff. And in fact, we're very pleased because we did retain the services of 2 young Bermudian scientists who have just started employment. They're trainees, and the expectation is that they'll continue their training and then be placed as full-time staff. So we are constantly trying to recruit to ensure that we have sufficient staff, primarily, not primarily, but preferably Bermudian, so that they can continue to operate in the lab. Insofar as some of the equipment is over 15 years old, so we will look to replace some of the equipment that's vital for us to conduct the services that we provide to the community.
And also on that, just to follow up, do you think there's a broader discussion that might be needed for the types of drugs that you said yesterday that are being detected and that are being taken for testing?
I'm sorry, a broader discussion?
Yeah, that may be needed with the probably law enforcement. The types of drugs that you mentioned yesterday that are relatively
tested, yes.
new to society.
Yeah. Well, those conversations take place regularly. The Minister of National Security could probably be best seized to discuss the discussions that he has with the police, as well as Customs obviously comes under him, as well as NDC. So those probably would be best suited for the Minister of National Security. Our role within the Ministry of Health is to test the products to ensure what they contain.
Thank you.
Thank you very much, Minister Wilson, for your remarks. Next, we'll hear from the Honorable Jache Adams, the Minister of Public Works and Environment.
Great job, Minister Wilson.
Well, thank you.
Good afternoon, everyone. Thank you for being here today. Every day in Bermuda, whether we are driving to work, walking along a public beach, visiting a historic site, or relying on safe waste management and reliable infrastructure, we depend on the systems overseen by the Ministry of Public Works and Environment. Those systems are not abstract. They are roads, bridges, parks, public lands, government properties, agricultural facilities, waste treatment plants, and renewable energy installations. They are the physical foundation of our country. Last year, in my first budget as minister, I talked about laying the groundwork for the future. We focused on stabilizing systems addressing long-standing issues and beginning to move critical projects forward. This year, we are building on that foundation. The theme of this budget is responsible choices, lasting benefits for Bermudians. For this ministry, that theme is not a slogan, it is a practical test. Every dollar allocated must strengthen infrastructure, improve resilience, and deliver visible results and durable value to the people of Bermuda. Responsible choices in public works means investing where it matters most. And lasting benefits mean projects that will serve this country not just next year, but for decades to come. This year, not only are we laying the groundwork, but we are doing the work to break ground. This budget provides $9 million to begin construction of the new swing bridge. For years, Bermudians have spoken about the importance of replacing this critical piece of national infrastructure. This allocation moves us decisively from preparation into construction. It marks the start of a multi-year replacement process for one of the most vital links in the East End. The responsible choice was to plan carefully, secure funding, and move forward in a structured way. The lasting benefit will be a modern, reliable bridge serving residents, businesses, and emergency services for generations. The new bridge will be engineered to withstand wind loads of up to 150 miles per hour, in line with modern building codes, while it will safely operate and lift open for marine traffic in winds of up to 35 miles per hour. The public can be reassured or assured that this will remain a fully functioning swing bridge, with operators retaining discretion to pause openings in extreme weather or poor sea conditions to protect public safety. Let me also address the issue of private roads, because this is something residents have consistently raised. While much of our recent focus has been on improving government-owned public roads, the reality is that many Bermudians live on or must travel daily along privately owned roads that have fallen into disrepair. In many cases, responsibility for maintenance rests with multiple owners, and where that responsibility has not been exercised, residents are left navigating unsafe or deteriorating conditions. That is why we have pledged $1 million to improve private roads, an initiative promised in the 2025 throne speech. This is not about relieving owners of their responsibility, but about ensuring that ordinary residents are not unfairly impacted by prolonged inaction. With the necessary legislative framework in place, this funding will allow the government to step in where needed, improve safety and accessibility, and bring greater fairness and consistency to how road conditions are addressed across the island. Additionally, we are investing $500,000 in expanded verge maintenance, increasing both manpower and specialized equipment to tackle overgrown hedges and roadside vegetation across the island. This means more crews on the ground, more frequent cutting, clearing sight lines for motorists and pedestrians, and safer journeys for everyone. But it is also about pride. Well-maintained roadsides reflect a well-managed island, and this investment ensures Bermuda looks as safe and cared for as it truly is. Good infrastructure is not only functional, it reflects who we are. Responsible stewardship also means ensuring that public assets are not left idle. This budget allocates $4.5 million to revitalize underutilized government properties, including Montpelier, the Admiralty House Ballroom, and the St. David's Lighthouse. These sites represent history, culture, and opportunity. The responsible choice is to invest in them thoughtfully. The lasting benefit is community engagement, tourism enhancement, and the productive reuse of valuable public property. We are also directing $1.7 million toward the restoration of our treasured national parks and public lands, from the lush pathways of the botanical gardens to the historic vistas at Admiralty House and our family-friendly public beaches. This funding will support upgraded landscaping, improved walking trails and signage, safer and more accessible picnic and leisure areas, and refreshed amenities that encourage residents and visitors alike to spend more time outdoors. Whether it's more benches under shaded trees, well-maintained lawns for children to play on, or enhanced coastal views that honor Bermuda's natural beauty, this investment is about elevating the everyday experiences of everyone who enjoys our open spaces. Our parks and shores are not just land. They are the heart of our island's identity and quality of life. Responsible choices are also about strengthening our self-reliance. This budget includes $2.5 million towards breaking ground on a new agriculture center, which many of our local farmers have been asking for. This investment supports the modernization of local food production and enhances Bermuda's food security. Global events in recent years have reminded us that resilience matters. So I want to be clear, supporting domestic agriculture is not optional, it is strategic. The lasting benefit will be greater innovation, stronger local production, and improved long-term stability in our food systems. Responsible governance also means maintaining the systems that protect public health and the environment. This budget continues major investment in the Tynes Bay Waste-to-Energy facility, allocating over $9 million to maintain and ensure long-term reliability. For a small island like Bermuda, where nearly everything we consume is imported and eventually becomes waste, the reliability of Tynes Bay is mission critical. We generate significant volumes of waste relative to our size, and modernizing and strengthening Tynes Bay is important to ensure it can keep pace with current and future demand, operate efficiently, and protect both health and our environment. At the same time, $1.4 million is allocated to expand the rooftop solar program across multiple public buildings. Reducing energy costs and supporting Bermuda's transition to renewable energy is both fiscally responsible and environmentally sound. It lowers long-term operating costs and strengthens sustainability. As we reflect on the choices set out on this budget, it is clear that responsible decisions do more than strengthen infrastructure. They also protect and enhance our natural environment. That balanced approach will define our legacy. As Minister of Public Works and Environment, my mission is to ensure that foundations of this country are strong, resilient, and sustainable for future generations. That means investing in our roads and bridges, but it also means protecting the ecosystems that make Bermuda unique, including our national parks, beaches, marine habitats, and biodiversity. It means supporting the Department of Environment and Natural Resources in conserving our natural resources, managing pollution, safeguarding fisheries, and expanding public access to the open spaces that define our island. Last year, we stabilized and laid important groundwork. This year, we advanced projects that strengthen communities, enhance our environment, and improve daily life for residents and visitors alike. In doing so, we honor the principle at heart of this budget, that responsible choices that deliver lasting benefits for Bermudians. Thank you.
Thank you, Minister, for your presentation. Right now, we'll invite questions from the news media, starting with Bermuda Broadcasting Company.
Good afternoon, Minister.
Good afternoon, Jasmine.
Just want to go back to Tynes Bay.
Yes.
So this is a aging facility. It's over 30 years old. It was quoted as needing about $500 million for a whole new system. I wondered if there had been any word of investors or anyone interested in, revamping this whole facility.
Sure. So we are at the very early stages of our pre-engineering phase. Once we complete the engineering phase, or the engineering analysis, we'll be in a position to have more concrete details of exactly how much this is going to cost. But I would roughly say that 500 is on the high side.
Okay. $9 million. How does this compare to previous years, would you say?
So previous years, this is a considerable increase compared to previous years, and it's the start of our fully refurbishment process. So we can fully expect in the coming years for it to actually be much more than 9.
Okay. So I'll go into the affordable housing issue. I know that's another ministry. However, there's significant number of government buildings that are probably underutilized. I wonder if there've been any discussions in repurposing them for the purpose of housing.
So for housing, well, that would, as you quite rightly said, would fit under another ministry. But what we can say is that between myself and the Deputy Premier, we continue to have discussions on how best our ministries can work and collaborate together, because we recognize housing is the priority that it is. So yes, those conversations are being had. What you'll notice in the statement is that there is a concerted focus on better utilizing and investing in underutilized properties. And so the options will go out there, but recognizing that housing is a priority, that is certainly one that is being considered.
Okay, thank you. It's been suggested that certain road paving equipment that's been purchased fairly recently, that it is too large to fit on our roads, which causes significant delays. I wondered if you intend to replace this equipment, or are you going to make it work somehow? Is there a consideration for working outside of normal operating hours?
Sure. So my response is it's a bit of a mixed bag opinion. There are certain people who feel, just as you mentioned, but there are other people who believe that this piece of machinery will actually create increase efficiencies and present advantages. The reality is that we have not rolled it out as yet because it's a bit of a bespoke product, and it's designed for specific types and conditions of roads. Of yet we have not reached yet. But when we reach that process, or when we reach in our plans to reach those types of roads, we fully expect to roll that out. So it would be premature for anyone to suggest whether it's right or wrong, good or bad. It's one of those things where we will see when it runs, and we also recognize that we are subject to adjust. And so, like any investment, like any new piece of technology, we were determined to find out how best to roll it out, and we will continue to do that.
It was purchased under different leadership. Was it a poor decision?
Again,
based on what you see?
it has not been rolled out yet. It has not been used yet. So again, it is premature for us to make any sort of decision whether it was good or bad. But we will find out when we do eventually roll it out, and we are flexible enough to adjust accordingly.
What is its specific use? When would it be needed to be used?
So, example, it is quite large. So, a great example would be that it needs to be on much straighter routes because of its size. And again, this was already understood. It was never intended to be used for all of our roads. The core function of our road paving equipment still is operating as is. In fact, our team is road paving today without it, so we can use it. But if and when it becomes operational, it will improve our efficiency, but more importantly, improve the quality of paving as well. And so that's the intended purpose of it. And when we get to that opportunity, we'll look to see the results.
Certainly. There's been a lot of complaints in the public about chicken culling and that issue. Traps are being used. There's not enough staff to use those. I wondered if there'd been any funds set aside to resource that.
Absolutely.
Area.
So I think in December I issued a ministerial statement detailing the increases towards our addressing that particular matter. So we have doubled our resources in terms of individuals out there culling chickens. So we've doubled the resources. We've also in the process of training farmers so that our local farmers can be trained to how to address those chickens as well. We purchased a number of traps that are now on sale. I think we are about 80% sold of our chicken traps. In fact, we are preparing to order some more. And so we recognize there's an issue. In fact, earlier today, I met with some local farmers who continue to express their challenges that they face with feral chickens. We recognize that in the importance of addressing this particular matter, which is precisely why we've ramped up the resources as we have.
Okay. And funding for dog wardens, that's been an outstanding issue too. Are we going to see any new government vets or staffing to help that department?
Yes. I wouldn't say staffing, but in terms of dog wardens, particularly filling out the vacant positions that exist, yes, there's full intention of doing so.
How many positions would be open?
That's
or
a good
vacant?
question. I will have to get back to you on that.
Thank you.
Thank you, Jasmine. Right now, we'll hear from the Royal Gazette.
Hey, good afternoon, Minister.
Good afternoon.
Could you just provide some timelines, if possible, on the new swing bridge and the new agriculture center that you mentioned? Are there RFPs are going to be sent out anytime soon?
Yes. So the swing bridge, the RFP will be issued. I hate giving timelines, but I believe between 2 to 3 weeks, the RFP will be issued. We fully expect that process to be roughly 4 to 5 months. And so certainly by mid to late summer, we fully expect to have at least a successful bidder and the process of construction to start.
And the agriculture center?
So the agriculture center, currently we are in the pre-preparation site phase. So you'll, if ever you go by, you'll start to see that the excavation of that particular area is done. And we fully expect to have the RFP out in the next month or so.
Okay, and lastly, last week I think in Parliament you were asked about the new asphalt plant. Can you say what exactly is holding up the plant from coming to the island?
Just logistics, just simple logistics, shipping and infrastructure and things of that nature. So it's logistics that we need to get sorted. But as I said, we recognize the importance of road paving and getting the new asphalt plant, shuttle buggy. Getting the new asphalt plant on island is absolutely a focus of ours. And I think in the same statement that I said earlier, that we fully intend to have it here shortly.
Thank you.
Thank you, Minister Adams, and to
Thank
Minister
you.
Wilson for your briefings on the 2026-27 budget. That brings us to the end of today's media conference.